I said at the health optimization topic, I said, okay, how about I tell you about the number one enemy to optimal health that probably 99% of you out there don't even know about and what you can do about it. And I asked the audience at one point, did you have any metals in your mouth? Any metals? And then stand up, please. And then I asked, I don't know if you've still been there. Then I asked about root canals. Who has a root canal or had a root canal treatment? 60% of the audience stood up. And then I asked, whom of you guys did they remove the wisdom teeth? And the whole audience stood up in a tribe of already optimizing people. So even there, 99% had still problems in their mouth. So metals is one of these enemies, root canals and cavitation. The metals comes with three different challenges. Toxicology, we just discussed it with the mercury. Immunology, because the immune system can always become allergic to mercury or any other heavy metal or any other metal because it's not supposed to be in your body. And third is always in this world of high loaded EMF, electromagnetic fields or waves, any metal in your body is going to be an antenna. And there is studies showing that if you have a phone call with your cell phone and you have a mercury filling, we have an increased mercury vapor output after this phone call or during that phone call, for example. Or if you have a titanium implant, it just heats up while doing the phone call, up to 3 to 4 degrees Fahrenheit, which means high fever at the spot. So the bone around the implant is always kind of dead. Yeah. So it's really a different environment. And since 2008, I think back then we reached the maximum exposure of EMFs. And I think the chart went like this afterwards. So it's exponentially. We don't even know how much EMFs we have. It's insane.
It
So you
is.
shouldn't have any metal in your body.
It's really frightening, and I know obviously you have spoken about EMFs and their role, and I know in the kind of health optimization world we're talking more and more now about the potential role of EMF in poor health and disease and so on, which is good that the message is getting out there for people
Yes.
that, let's just say, for a period of time do have these metal fillings in their mouth. What kind of approaches do you recommend in terms of just getting by and trying to minimize EMF exposure? What are your kind of top tips?
The easiest tips always to minimize EMF exposure is number one, shut off your Wi-Fi at night. I think you probably will tell that to all your
Yeah.
patients. It's for free. Just switch it off at nighttime. Because what it does, you don't hear it, but if you have like a machine to make it, I don't know how you call it in English, a measure device
Yeah,
to
and
measure it,
that's
you
right.
hear the Wi-Fi. It's like, yeah, that's how it pulses. And this interferes with your whole system, especially if you have metals in there. Second one is you put this one on airplane mode. And no, your phone shouldn't be on at night, at least. I would say it now got dark. Usually I should wear my blue light blocking glasses right now. I just forgot them downstairs because I thought it's still sunlight out there. But I would use, so after it's getting dark, I would use blue light blocking glasses. That's not because of the EMF, but it's just also because of your exposure to light. Yeah, it's kind of an electric thing. But the main thing is Wi-Fi and switching off the to airplane mode. And I always have a thing. It's called I don't know how you call it in English. It's a little device that helps with EMS to kind of balance it out. It's called Vivo Base. We have it in the house. It's like it has a 32-meter radius. So whatever you can do. But obviously in my house there is no Wi-Fi. It's all on landline. I can switch it on to download stuff, but usually I don't need it.
Interesting. I know in our household we've got shungite crystals just about everywhere, and it was interesting because when I first found out about shungite crystals and how they can kind of reduce EMFs, I thought I needed this for myself. So I got one of the EMF monitors, and first of all, super scary to put that to your mobile phone. That's enough to make you not want to touch your mobile phone much at all. And then to the Wi-Fi router, which is even worse. And then we put big blocks of shungite on the different devices, and the difference it made was really good. I mean, obviously it doesn't completely eliminate it, but certainly reduce it, which is good. So It's really interesting. And like you said there, if you've got mercury fillings and you're just having a simple phone call with your phone to put to your ear, which is a few inches away from that metal in your mouth, it's a really scary thought that you're just causing more and more mercury to leak into your system. That's really
Yes,
frightening.
this is a real study. You can find it in my Instagram. It's PubMed. You can see it on PubMed.
I think I might have
I
seen this
did.
one.
I didn't make it up.
I think if I'm not mistaken, was it from 2008 or 9 or something like that? I think the first study.
2008. I think it was really 2008. This is also when we reached the critical limit of EMF exposure, and now it's like exponentially. Nobody knows anymore what's happening.
Wow.
So I think it's important that you know about it and then take precautions. That's it.